You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, liposuction, new technology that literally dissolves fat off your body. With us, we have an expert on the topic. She's known as America's favorite dermatologist, Dr. Tess Mauricio. Dr. Mauricio, welcome to the program.
Great to be back, Randy.
Now, you always look good, by the
Thank
way.
you.
Always a pleasure to have you on the show.
Thank
Were
you.
you voted as best dressed at one time in Style magazine, best dressed doctor here in San Diego?
In San Diego it is, and hopefully I'm living up to the expectations of the voters. So yes, well, I think this is why I love what I do. It's about art, it's about aesthetics, it's about beauty, and body shaping, body sculpting. I mean, the doctor, your surgeon, has to have an eye for beauty, and hopefully, my patients really appreciate when they see me. I'm dressed nice, I'm well coordinated, because that's part of who I am.
Interesting.
And I think that's one of the reasons why they come.
So when you look for a doctor, do you think you should look for somebody that has an eye?
Absolutely.
Or that looks good, their office is neat?
And it's all part of the artistic part of rejuvenation and what we're talking about, body sculpting. Because
is it really sculpting, by the way, or is it just sucking fat?
Well,
Seems
this is 20 years ago, it was really suction. That's all.
Right.
It's just sucking out fat. But now we've advanced so much in technology, in technique, and now it's truly body sculpting. And really, you have to be an artist because it's sculpting.
Is it the most popular procedure of all cosmetic procedures?
It is the most popular surgical procedure. It's the #1 surgical procedure in the United States. And the reason, I think, is because now we can achieve great results, very, very safe, so it's no longer scary to patients. They've seen friends and family members that have had liposculpting, and they look great, and they know they can have that done.
You say it's life-changing for some people.
It's life-changing, I think, for most patients.
All right.
They are mostly patients who have tried everything. A lot of them have tried dieting, have tried exercising, or they just want a new start.
For men, by the way. And who's doing more of it? More men, more women? What is it?
Well, I would say nowadays the reason that this whole market is expanding is we're seeing more and more men. The #1 area, the neck, the male chest, which you can understand can be embarrassing. After 40 or 50, men can develop, fat in their chest area that ends up looking like breasts. And
have you been doing some of those?
Many.
Really?
Yes. And obviously
I heard
that
it's
abdomen.
tricky though, the chest.
It is tricky, but it's one of my expertise. And
Really?
you
Okay.
have to go in there with the smallest of tools and gently sculpt it away, and also blend it in the other areas that you're not doing. And that really is where the artistic ability of your surgeon comes in. Because in liposculpting, the result is not so much what you remove, it's what is left.
Interesting.
Yes.
Wow. Okay. So for women, what's the most popular area?
The most popular area for women, I would say, is still the abdomen and the waist.
Okay.
To recreate that nice waist and nice silhouette, and being able to allow women to wear the outfit that they can no longer wear. So that's a big area. The other area are arms. Arms are so...
How well do they treat?
Well, arms are so important to cosmetic appearance of women. Basically, I have many patients who come in and say, I have not worn a tank top for years. I'm always having to wear a jacket to cover up my big arms. Well, before, with traditional liposuction, arms were one of those, don't touch type of zone.
Is that right? Okay.
Absolutely, because of the fact that we were scared that if we remove the fat there, we would leave patients with loose skin, which ended up looking worse. But now with the technology we're going to talk about, and in my practice, we combine the latest in technology for sculpting and also skin tightening.
You say you're surrounded by equipment.
Exactly.
Tell me about your technology. What do you
And basically we offer the patients the best in technology, along with really unparalleled artistry. And whenever I do a lipo procedure, I'm surrounded by my Vaser device, which is ultrasound liposelection. Gently melts fat, leaving intact blood vessels and nerves. So it's really, truly a gentle way where we melt away fat, especially in patients.
But are you sucking as well? I mean, there is...
Well, that is not sucking.
Okay.
That's the first step. So just melt away the fat, but in a gentle way, non-traumatic way, where we was never able to do that before. And then I go ahead with my small little tools, to actually gently sculpt away the fats,
So small, tiny cannula.
Cannulas,
Okay.
that's the word, and that's the tool that we use. And nowadays, our tools are as thin and as small as the tip of your pen right there.
Really?
Before, when you watch like Extreme Makeover, the patients would be really scared because they see big tubes
But they're still
going
doing
in
it
and out.
though. I hear that there are, power assisted and bigger lipo. What are your thoughts on that?
The reason that surgeons are wanting to do that is it cuts down on the time for the surgeon. It cuts down on the energy and work that is involved in doing meticulous liposculpting.
So you're saying the results aren't as good, in your opinion?
Yes, because you can imagine if you have a larger tool, a larger tube, it's almost impossible to create a completely smooth surface. Whereas if you have a cannula as small as the tip of your pen, it's like sculpting, chiseling slowly away at the unwanted fat.
So the results are better today because of this ultrasound technology.
Ultrasound technology, patients actually will get less downtime, less trauma, better healing, and it's safer because you're not, there's not as much bleeding through the procedure. And then as far as
safer
sculpting,
than the old way?
Absolutely, much safer. I think that's one of the reasons why more and more patients are coming in to have liposculpting procedures now. You no longer have to worry, I'm gonna, something's gonna happen to me during a cosmetic procedure.
Now, so I understand this correctly. So the old way, it was kind of digging into the fat,
digging in,
scraping it out.
Avulsing, yes, scraping,
And so
just kind of. Now
put
we
this,
put
is it a wire? What is it?
It is basically another metal cannula, but it has special ultrasound in the tip that goes and vibrates and then melts just
so it's
the
like
fat.
Heats the area.
Heats the area, dissolves the fat, and then I go in with my small little cannulas, and then I take it away. And then the last thing, which like we were talking about the arms, the last thing is I actually use a special laser called LipoLight.
Okay.
At the end of the procedure, after I've taken down the fat, underneath the skin, and heating underneath the skin to help tighten all of the areas that we've done.
So there's 3 parts of this.
Three parts, and this is what I call the My Lipo personalized body shaping procedure. And so every single patient gets a special personalized program in giving them the best results possible.
Do you find that these patients, after they get it done, that all of a sudden they're following a better diet, they're eating better, exercising more?
Of course, because unfortunately, and I tell this to all of my patients, if you stay the same weight, because they always ask me, how long will this last? You know, the results, because they love the results. How long will this last? So I tell them, if you stay the same weight, which means you have to watch what you eat, you have to exercise, you have to live better, then the results are permanent. But if you do end up gaining a lot of weight, if you let yourself go,
but those fat cells are gone though, right?
Those are gone. That's why it's forever. But if you gain enough weight, and some patients unfortunately, gain 10, 20, 30, 40 pounds, you can get the fat back in the areas.
So this is not just for the younger people. I mean, you get a lot of business people, a lot of successful people.
Absolutely.
40s, 50s.
Even 60s and 70s.
Getting liposuction.
Getting liposuction, getting liposculpture.
Right?
And I
Really?
think it's a testimony to basically the technology, the advances in technology.
So a 70-year-old now can get this liposculpture.
We just did a 72-year-old man. And he's very healthy otherwise, because obviously you have to be healthy to have this cosmetic procedure. Very healthy otherwise, and works out, eats well, but had developed the male, chest, the fat in the chest, and fat in the abdomen and love handles. And he said all he wanted to do was be able to move better, be able to bend and tie his shoelaces. Certain simple things like that, and obviously wear a shirt without him feeling, self-conscious about the chest.
Yeah.
And we did that, and he recovered great. I mean, he was one of our best
patients. Can they
patients.
go back to work the next day? I mean, what do you tell them?
It depends. Everybody is different.
Abs and flanks.
I did the lipo on my husband, abs and flanks. Went to work the next day.
I knew there was something, you
That's
look too good. You look too good.
That's why he had shirt. Yeah, exactly. That's how and it didn't used to be like that.
How many pant sizes can you lose? I mean, how many dress sizes have you heard women?
Right. Well, I've had a patient where we can remove small volumes of fat, or we can remove larger volumes of fat. And we can remove as much as 4 liters of fat in a day. So that is a lot. That basically is about 8 pounds of fat.
Is that right?
Yes. And so I have patients who were like size 12 pant size, women's size, and they come back, they're like, I'm a size 8 now. I'm a size
really?
8.
Now, are you getting a fitter patient because of this technology? You
Well,
know, the lean athlete, just somebody that has maybe little saddlebags or.
I have a lot
right
of
around the belly
personal
button?
trainers who come to me, and obviously they work out, they take care of themselves, but as aging and the hormones change, the fat distribution changes as well. So they start getting, you know, the belly. For women, they can't get rid of the thigh saddlebags or the inner thigh fat, the knee fat. Easy enough to do all of those procedures. Sometimes we can do them under local anesthesia.